In everyday optometric practice, you will use a non-contact tonometer to measure your patient's intraocular pressure. The device is used by many practitioners because it's an established instrument, it's quick and easy to use and minimally invasive. However, there will be times when you will want to measure the intraocular pressure more accurately, and that's when you will use the Goldmann applanation tonometer. This is slit lamp mounted, but you can get a handheld version of the device called the Perkins tonometer. Don't forget, however, that the accuracy of all tonometric devices is affected by various patient physiological characteristics, and these will be covered in your Tonometry 1 and 2 lectures later on this year. It's also important that you don't consider the intraocular pressure measurement in isolation when you're assessing your patient's relative risk of developing or having primary open-angle glaucoma. Remember, there is a triad of tests. We look at their intraocular pressure measurements, we look at their optic nerve heads or optic disc examination, and we assess their visual fields, as well as taking into consideration the various risk factors they may have for developing POAG. So please don't forget that. However, the purpose of this teaching video is to take you step by step through how to do Goldmann applanation tonometry. There are 3 components you need to consider: the tonometer itself, the base plate to insert it into the slit lamp, and the biprism. On the left of your picture is the traditional biprism, but these days many people use the disposable prism, which is on the right of your picture. To anaesthetise the cornea, you can use proximethicane or binoxonate hydrochloride. Proper name is oxybupropion. We also have to instill fluorescein into the eye, and you can use a fluorescein minim or wet of fluorette with either saline or binoxonate, or whichever drop you're using.
Okay, I'm going to put an eye drop in your eye, which will numb the surface. If you'd look up, please. And next I'm going to use the fluorette to add some fluorescein, which will aid my measurement of intraocular pressure. Again, if you'd look up. Well done.
Remember, prior to instilling the anaesthetic drop, make sure there is no history of adverse reactions. Check the drug name, concentration, expiry date, and record the batch number. Put the drop in the lower conjunctival fornix and warn the patient that it will sting. Don't forget to occlude the punctum. Also, please don't forget to instill fluorescein. And it's sensible to also check corneal integrity prior to and after the procedure.
Okay, I'm going to check the intraocular pressure using the Goldmann applanation tonometer. Attaching the tonometer head, cleaning using an alcohol wipe, and I'd usually allow it then to air dry, but to save time I'm going to use a tissue here. Next I attach the base plate to the slit lamp, it's clicked into place there, and then attach the tonometer to the base plate and set the pressure to 10 millimeters of mercury.
Remember, insert the biprism so that it is horizontal in the tonometer. Put the base plate into the slit lamp and make sure you listen out for the click. Then insert the tonometer itself into one of the 2 holes in the base plate.
If you just come forward, please, pop your chin on there. I'm going to switch to the cobalt blue filter. Move this around so the tip of the tonometer is illuminated. Advance the slit lamp. Sit back, please. So the patient's intraocular pressure is 15 millimeters of mercury, which I would record in the patient's notes, along with the time and the instrument used. And if you just come forward once again, I'll just check the cornea is okay. following tonometry. And sit back. Thank you.
Remember, use a blue light, maximum height and width of beam, maximum brightness, and a wide angle of illumination so that the tip of the tonometer is fully illuminated. Then bring your slit lamp forward to make contact with the cornea. Adjust the height of your slit lamp to be sure that the rings are of equal height and width. To start with, pull the slit lamp back to make the adjustment, but when you become more proficient at the technique, you can do this whilst the tonometer is on the cornea. Then you need to change the applanation force by turning the dial. Turn it clockwise to increase the applanation force, and turn the dial anti-clockwise to decrease the force. This will have the effect of changing the separation between the two semicircles. Increasing the force increases the separation between the two. Decreasing the force reduces the separation between the two. The endpoint is reached when the inner edges of the upper and lower semicircle are just touching.